All right, so now we're moving on to the diaphragm and the intercostal. So procedure number 25 and 26. If you see me kind of looking over here, so I have it written down because I want to read exactly what you guys have on your procedures packet. So the diaphragm, we're going to press inferior to the xiphoid process. The xiphoid process is that little point at the very bottom of your sternum. And we're going to press inferior on the edge of the ribs to make contact with the diaphragm. The diaphragm is the parachute muscle underneath. Our intention here is to unlock the breath. So not only are we trying to unlock the breath, but if I'm trying to think of a bone-to-bone intention, I also want to make space between the thoracic vertebrae and the rib cage. I want to open the body up this way to open up the chest so someone can take deeper breaths. And the deeper that they take a breath, sometimes it'll help with your own compression. So the xiphoid process is the very tip. I'm not going to push on the xiphoid process. I'm just going to be lateral to the xiphoid process. We don't want to push on the bone. So I'm just going to kind of roll right off the ribs. I'm going to roll right off the ribs, and then I'm going to vector underneath the ribs and try to lift slightly. I might get myself in a horse stance and working with this breath. I'm coming down 1. And I'm just 2. Now I feel like I'm underneath the rib cage slightly, so I'm going to start to vector at a diagonal to go underneath the ribs. Maybe a slight lift up. Supported thumbs, always supported thumbs. I can make small circles if I like. This is also too where you want to maybe encourage your client, whatever breathing rhythm they have, that's a natural breathing rhythm for them. So I try to work myself with their breath, and if their breathing gets deeper, then it shows me that I'm doing a good job, but I don't really like to force people to take deep breaths. But with this work particularly, I might ask them to try to take a little bit of deeper breaths, because as they breathe deeper, it pushes that diaphragm more into my thumbs, which is going to allow for more effective work. So Elisha, whenever you feel like you could, just take a little bit deeper breaths. Now I just got way, way deeper than I did my last compression. And I'm just making small little circles. And I just like to keep the same rhythm, 3 breaths to sink in. I hold for 3 breaths, and then I get pushed out, and usually it only takes about 2 breaths for them to push me out. And then I'm going to slowly come on out. Move myself over. Don't be afraid. You can kind of pull back on them. Just get your weight in your back foot so you have more weight to push into your work. Get myself down a little bit more. I was working a little bit above my work, so I scooted down. So now my dantian is a little bit more, not a little bit more, a lot more lined up with where I'm working. So I'm 2 breaths in. This will be his 3rd breath. And you can see I'm kind of coming down with a little bit of a lift. And now I'm just going to hold it for 3 breaths again. You can be stagnant with your compressions, making small little circles, really bringing the oxygen into that area, whatever feels comfortable for you. And then I would just continue this compressions all the way down the whole length of the rib cage till you feel the very bottom of the rib cage there, which would be rib number 10. That is how we release the diaphragm. And then I would come around to the other side, and I would start my second side of diaphragm work all the way around, just like I did the first side here. And you can see a slight little redness. We're bringing, again, this is always a good sign. This is a visual sign that we are affecting the body in a positive way. So then we're moving on to the intercostals. Intercostals number 26. Stroke or compress intercostals between the ribs to release the ribs. This is the intercostals are another accessory breathing muscle. So on our skeleton, there's lots of space between each of these bones. In real life, sometimes I'm on one intercostal and I feel myself flying and kind of going over a bone, and I'm in another intercostal. It doesn't take a lot of pressure to release intercostals, and it can feel very uncomfortable if we're on bone. So take your time and don't try to dig around. You can start wherever you're comfortable. If this was a female, I'm sorry, I should have mentioned this earlier. If this was a female, I can do all this work with her draped. And again, just like I might have asked a male to adjust himself down below, I sometimes will put my hand here underneath the breast tissue, and as long as I'm not touching nipple, it can feel it's usually fine, or I might ask them if I'm not comfortable to kind of adjust themselves, so it allows me to get right underneath the breast tissue, where if we know anything about fascia, we know it's very obedient and it will hold its shape. So if somebody is wearing a bra, especially one with wires, this is a lot of compression in this area, where a lot of times people won't work because it's so near breast tissue, but it's so necessary and needed. So again, don't be afraid to build your confidence so you can really help people breathe better and function better. So find the bone and then roll off the bone and try to find yourself in between. It's a little bit more mushy. You know the difference between bone and muscle. And I'm just going to stroke out in between the rib cage, in between each of the ribs. I'm starting right off the sternum, and I'm going to stroke out as lateral as is comfortable for me. So I'm not going to lose my Tai Chi trunk. This is also another move that if I had a very wide person, I might ask them to scoot closer to me. And you can make small circles within your stroke. If you find some congestion in that intercostal, in that fascia, that muscle, you can make slight little circles. And Elijah, if anything's uncomfortable, speak up, okay? And that's about as lateral as I'm going to go. And then I'm gonna come back and I'm gonna do the best I can to kind of just move down the next rib. But again, when you're on a real live person, it's not as easy as it looks on a skeleton to get in between each of the ribs. So do the best you can. Whatever you're doing is better than they had before, because not many people go between intercostals. This is so great for anybody who may have asthma, anybody who plays a wind instrument that they're blowing a lot in a flute or a saxophone, singers, swimmers, athletes. Really, if you breathe, this is good work. So I would just continue these strokes out in between each of the ribs, as lateral as is comfortable. And again, on the skeleton, they kind of go straight back. On a person, they kind of go at like a little bit of a diagonal, especially as we get towards the bottom. So do your best just to be in between the bones. And if you kind of find yourself moving over and now you're in another intercostal space than you started, that's all right. Just do the best you can. So go as lateral again as is comfortable. And then to get to the lateral ribs, I can also do this work sidelined. So there I go, I just went over. I started down here and now I went into this intercostal up here. But hopefully, did you feel it too, discomfort as I went over that bone? I didn't even quite realize I was going over a bone until I found myself higher than I imagined. Okay, sideline work. So Elijah, if I can have you just roll over onto this side. And if this is a female, I can just have her be draped here. I like to try to get them as stacked as possible, as comfortable. And could you mind scooting in a little bit for me? What I like about this work, perfect, is that I can kind of chillax when it comes to this, because I think support on their backside and sitting kind of close can be very comforting. So I can get myself right up against them and like have them lean into me. And now I have all of the ribs along the side of the body. So what's nice about here is now I can really find that 12th rib, and I can just start down below at the very, and now I know for sure where that 10th rib is. And I usually, I'll go up a little higher so I can see me better. I usually will try to, now we have a real good diagonal. We can do where we just do a finger either going back or forth. And we can warm this, let me warm this up a little bit because it feels kind of tight. So just kind of warm up the superficial fascia a little bit. The sideline work, you guys, this is a lot, not a lot of people get sideline work done. And that's the whole fourth of your body, right? We have 1 side, 2 side, 3 side, 4 side. So there's so many things to access here, and it just makes things so much easier for me. Sometimes bringing this whole side up instead of me having to lean into it with they're either in a prone or supine position. So I'm just warming up the fascia a little bit to maybe make it a little bit more accessible to me. A little bit more easier for a stroke. All right, and then we'll get to the work. Just like playing with clay. We're just playing with the clay so we can get inside and mold it and create our masterpiece. This is my son, so I created this masterpiece, and I'm just making it better. Yeah, he agrees. Okay, so find a rib just like before. You can use fingers, you can use thumbs. And just slowly open up that space in between the ribs as best as you can. Again, it doesn't take a lot of pressure for intercostals to really release. So you don't have to work really, really hard. You just have to work very specific. And as I come to the posterior side, I can switch into fingers and go back until I just start to feel thickness of muscle. Sometimes I feel like I can take it all the way up to the erector spinae, depending on the size of my client. And this is also really nice work, again, for females, where that bra strap lies really tight. Sometimes now, you hear girls wearing bras as young as 9 years old. So that's a lot of constriction in this area. So just nice and gentle, easy breezy day of massage. And I can take it all the way up. Gets a little thicker because here we have latissimus dorsi and the teres muscles. So I usually take it up until I just can't feel the bone anymore. So that is the sideline intercostal work. And then I could flip them over and I can do everything on the second side. And then I redrape and we are all done. It wouldn't be a bad thing. Sometimes what I'll do is I'll take the padding of my headrest off and I can slip it under their neck to give them a little neck support, especially my older clients who need a little bit of a pillow. So that's something you can always do whenever you do sideline work as well. Thank you. We're all done.